Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, if you see the pathogenesis of Helicobacter pylori. So, in the pathogenesis of Helicobacter pylori, the first and foremost, the growth of the Helicobacter pylori is at an optimum pH of around, it grows at around a pH of 6.6 to 7 pH. Okay, it grows at 6 to 7 pH. So, actually, it will be killed at pH of gastric mucosa because pH of gastric mucosa is acidic, so it easily gets killed at acidic mucosa. But will it get killed? No. The H. pylori mainly attaches to the gastric mucosal cells. This is because the gastric mucosal cells have some adherence factors which will help in adhesion of the H. pylori. That is fine. Then how is it able to survive in the acidic medium? This is because this Helicobacter pylori is mainly found in deep mucosal layer near the epithelial surface. It is present in the deep mucus layer near the epithelial surface. Over here, the pH of around 6 to 7 is present in this deep mucus layer because it is a mucus layer. See, this is the epithelium and there is mucus present here, and over this mucus there will be acid secretion and everything will be there here, okay, in the stomach. So if it is present near the epithelial surface deep in the mucus layer, obviously it is protected from the gastric pH. Then the virulence factors of H. pylori are very important for causing the disease. So virulence factors of H. pylori are called as vacuolating cytotoxin is a virulence factor which is VAC-A, which is called as vacuolating cytotoxin. And then we also have some group of genes which are also act as virulence factors, which are CAGPAL gene also acts as virulence factors. Very good. Now, how does this H. pylori causes infections? First, H. pylori will colonize. Once H. pylori will colonize, it will decrease the somatostatin producing cells. So, because the somatostatin producing cells are decreased, so there is increased production of gastrin occurs. This gastrin increases the acid production, and thus there is increased acid production will cause gastric metaplasia occurs in the duodenum. There is gastric metaplasia because of increased acid production in the stomach. So whenever there is increased acid production in the stomach, this acid also reaches the duodenum. So because of this acid will cause metaplasia in the duodenal mucosa, resulting in gastric metaplasia in the duodenum, thus resulting in ulceration. So this is the pathogenesis of H. pylori.
thank you and thank you for watching.